Hi, my name is Aretha Jones, and today I will be demonstrating to you exactly how to don and doff a chemical mask. In non-military terms, that's called putting on and taking off. Now, my profession in the military was chemical, so with that being said, I was the individual who actually gave these classes on how to actually put on and take off your chemical mask, your chemical protective suit, and how to actually clean your mask and keep your protective suits and make sure everything was ready when the time came for war if you had to actually put these things on. You have so many, that's a total of 12 minutes um, to put on your chemical mask and your gloves and your boots and your top and your bottom uniform, which is called the JS list. But today we're going to speak specifically about your chemical mask. Today I'm going to show you the components of the chemical mask. And the chemical mask has a carrier. You have your extra set of lenses. These are your darkened lenses. Extra set of lenses. I don't know if you can see that because of the light. You actually have your TM. Your TM is what we call a technical manual. This technical manual actually shows you how to actually go through the process of disassembling, reassembling your chemical mask to keep it clean, to keep it well maintained. Here you have what they call a waterproof bag. And here is your quick go-to guide. It's a flip guide of how to actually pull preventive maintenance on your chemical protective mask. You also have the same information in the small TM book. Here I have a can of spray, which is going to be the testing element at the end of the donning of your chemical mask. And this is the actual chemical mask. And the mask contains a harness, which is actually prepared and ready to be put on. This is the inside. This is the harness actually prepared, flips over the outside. This is the canister that actually filters the air that goes in and out when a person is actually wearing their chemical mask. So this here filters it, and these here are they actually resend new chemical filters out every so many years, and they get rid of the old ones and they bring in new ones. Over here I have some isopropyl rubbing alcohol and some quick cleaning pads. These quick cleaning pads is for just that, quick cleaning. So if you want to take and put some alcohol on the pad real quick and just wipe it down, changing out your pads frequently, and this way to give you a quick cleaning down of the inside of the mask, the little juice tube, the drinking tube, which is on the outside of the mask. And it sits right up under here. So when you want to take a drink, you just pull this tube down, as you see here, and you can drink. And you'll drink from a canister that actually goes with this chemical protective mask. Doesn't go with the mask. It's not part of the components, but you can actually, this is what we use to drink from the canister when we have to wear these chemical protective masks. You know, you do get kind of thirsty, so we use that. We put it down to a little hole that's provided there, and we turn it up, and we drink. Okay? Now, this is my son, Kendrick. He's going to be my assistant in this process, and he's going to help me demonstrate exactly how to don and doff the chemical mask. Doffing is really easy. You're really just going to take it off. Donning is a short process. So, with that being said, we're going to go ahead and place the chemical mask, the open portion, right over his face. He says it's a shame to cover up a beautiful face like this, but in this situation we have no other choice. So we're going to go ahead and put it over the front of the face, and then he's going to go ahead and pull the straps over his head. Okay, so once the strap is pulled over your head, there's 6 straps, and then there's a harness that fits just right. Right now the harness is kind of low. Once we adjust these straps, it will actually allow for a perfect fit, a much better fit. So we're going to go ahead and adjust the straps, but we're going to alternate as we adjust, because you have your top two, your side two, and your bottom two. So we're going to do a little tugging, a little slight tug at the bottom two. Then we're going to go to the top two. And then we're going to go to the middle two. Okay. Now, in doing so, I can already see the harness is a little low, so I'm adjusting it, and I'm going to re-tug. You really shouldn't be able to feel any air coming in along the sides, and I really shouldn't be able to put my fingers in on the sides. And I feel my finger could fit in here a little bit on the side here. So I'm going to give a little more tug. Okay, so right now he should have a really snug, comfortable fit without it being too tight, because if you make it too tight, it can actually cut off your circulation. And we don't want it to cut off your circulation. We want it to just be comfortable for you where you're well protected. Okay, so the next process is going to be donning the mask. So he's going to actually cover the front area where the drinking tube is with his hand cupped like this, just like so, over the drinking tube. And he's going to blow out as hard as he can and hold his breath, and then he's going to stop, and then there's a hole in the canister on the side. He's going to breathe in real hard. Okay, loosen up. Okay, when he does that, you'll actually see the collapse in the lens where it's getting close to his face, making so to have a good seal. Let's do that again so we can see it. Okay, all right. How does that feel? Okay, so now we want to test to see if we actually have a good seal. So what I'm going to do in order for him to test and see if he has a good seal, don't worry about it, is to actually spray this agent here. We're going to pretend this is a chemical agent, right? But it's just some smell good for the house. So just put a little right there and see if he can smell it. Now we'll wait for it to settle and see if he can smell it. But while we're waiting, we actually have a piece of equipment in the military that we actually sit every individual down, and we plug the machine up to the mask, and we do a head movement, a rotational movement. This process will actually help us to see if this individual has a good fit on the mask. So we don't do this ourselves every single time we prepare ourselves to use the mask. We do a test of the mask on the equipment that they use at least once a year to see if they have a good seal on their mask, or every 6 months. Depends on the unit and what the commander's intent is. So we'll go ahead and test it and see. And then if it's a good fit, they're good. It's just when we give training and things of that nature, we have to make sure that when they go through that gas chamber, that they have a good fit and they're not going to get in there and choke like crazy as they're going through that gas chamber. So we're going to test now to see if he has a good fit. Do you have a good fit? Can you smell anything? You don't smell anything. Okay. So we have a good fit. We have success. If by chance we did not have a good fit, did not have success, there would have been a number of things that could have been done to challenge this. We could have continued to alter these straps, like this one here, to see if everything was fitting okay, and retest again and re-don and seal. If that didn't work, we could take the canister off and change it out because it could be a bad canister. That wasn't working. Then there's little seals in here. When you do preventive maintenance, you would make sure all of that stuff is taken care of before testing and make sure everything's good. So since we have a good seal, we have success. So now the next step is taking it off. Taking it off, we're going to do just that. We're going to loosen up the straps a little bit, just a little bit. Okay, and then he's just going to lift and break the seal of the mask. Okay? And that's how you don and doff a seal. Thank you.